Lastly, parasite detox. So, Dr. Josh, this is your specialty. A lot of people don't know about brain parasites. Can you tell us about brain parasites and then some steps to help protect ourselves from brain parasites?
Sure. So brain parasites are much more common than people realize. Most Americans have been exposed to parasites. Common areas of exposure are going to be from insect bites, tick bites, mosquito bites, and then also from raw fish if you eat sushi, or from raw pork or certain raw meats. And these parasites are are opportunistic. They're going to go wherever they can in the body, and unfortunately sometimes they will go to your brain. And I've definitely seen patients with Alzheimer's, and one of the contributing factors is parasites. So if you do have parasites, what are some of the things that you can do about it? Well, the first thing I would say is seek medical attention. This is not something to try to do by yourself, and it's not the first thing I would treat. I would do detoxification before I would treat parasites.
Yeah. So talk about that because a lot of people say everyone should do a parasite cleanse. Everyone should do this. And your thought is maybe, but first you want to do the heavy metal detox. Can you talk with people a little bit about this really important step?
Yeah. So first I would do a detox, and not just against heavy metals, because if you take binders, not only are they going to bind the heavy metals, they're also going to hopefully bind some of the petrochemicals, the PCBs, the DDTs that many of us are exposed to. I mentioned glutathione. I'm also a big fan of phosphatidylcholine, which is another supplement that's fat based, that can push the fatty toxins out. So, but assuming, let's say you've already done a detoxification, the next step is, okay, so how in the world am I going to remove some of these parasites? And the answer is there are a lot of both prescription medications like azithromycin that are anti-parasite, but there are also supplements you can take, like rosemary essential oil, tea tree essential oil. There's black walnut. There's methylene blue. There are lots of different options to go after parasites.
And now, how do people take those essential oils? I think a lot of people are into natural medicine and essential oils. Can you name some of those essential oils some more? And then how do people take them? What are these specific steps?
Yeah. So the first thing is, unfortunately, the out on the market today there are a lot of adulterated essential oils, basically petroleum that's been processed in a lab, as opposed to taking a plant and extracting the oils from it. You want the ones, from an oil from a plant. And I mean, my favorite company is doTERRA, but whatever company you use with, you want to be able to identify on the bottle the batch that bottle actually came from. That do they do a mass spec gas chromatography to actually analyze the sample and prove, or third party testing to say, yes, you're actually getting the essential oil that you want. And if you do that, I feel perfectly comfortable taking rosemary essential oil and putting it under my tongue, because if I put it under my tongue, I know the brain is very close. It's going to get the essential oil will get absorbed pretty quickly in my mouth, and a lot of that will go up towards my brain.
So just a couple drops of any of these essential oils under the tongue.
Well, specifically, rosemary is safe. So is tea tree, and so is Spanish sage.
You also
I'll,
like clove, don't you?
I do like clove, but I would warn people that clove will burn you. So do not put a few drops of clove in your mouth. You'll get burned inside your mouth. So instead of doing that, clove essential oil I would put in a capsule and swallow it that way.
Okay, so a clove supplement.
Yeah.
Terrific.